Hey, what's up, guys? Welcome back to Confessions of a Doctorholic. I'm your host, Dr. Slayman, and today's story is straight out of one of those wild night shifts where everything just unravels, but not in the way you expect. Let's jump into it. So I'm covering the trauma service at a regional hospital, which means you're juggling a mix of patients, trauma, vascular, a bit of general surgery. You name it, we see it. And we get this consult. Post-op day 5. A trauma patient who had an intratrochanteric hip fracture repaired. She's now nauseous, vomiting, and her abdominal x-ray shows dilation. Now, usually dilation on an x-ray post-op can mean a few things. Could be an ileus, could be an obstruction. We didn't have a CT scan at the time, and CT is honestly gold standard when it comes to ruling in or out a bowel obstruction. So we think, okay, likely an ileus based on her history, but let's lay eyes on the patient anyway. We get to bedside, and it's already one of those consults. She doesn't speak English, and even our interpreters don't speak her specific dialect. So we do what we can. We call her son. He helps interpret. Things seem stable at first. We ask if she has any tummy pain, and she says no. And then bam, she just zones out, like full on, checked out, eyes glaze over. It was so sudden and so surreal. We look down, and her lower extremities are mottled. No pulses, not good. We call a code. She's crashing. And just like that, the room fills. An ICU attending rushes in and starts this mini debate mid-resuscitation. He's like, I reckon she's septic. This is an acute abdomen. It's got to be a perf. Meanwhile, I'm looking at this patient whose heart's ejection fraction is 10%. Like, how is this woman even alive, sitting upright a few hours ago? In med school, I would have thought 10% ejection fraction is not compatible with life. But here she was fighting. We try to explain we don't think it's abdominal sepsis. We're pretty sure this is cardiogenic shock. She's not perfusing because her heart's just done. But he's like, no, this is septic. It's all in her belly. I'm just standing there like, okay, how about we intubate now and argue later? She codes. We get her back. We move her to the ICU for closer monitoring. A few hours later, she finally gets that CT scan. And guess what? No obstruction, no perf. Just one weirdly dilated segment of her transverse colon. Now the ICU team is like, well, maybe we should put a rectal tube in, decompress from the bottom. But even the distal colon is decompressed. So what are we even decompressing? We're all just standing there staring at the scan going, question mark. It was one of those nights where everything hits the fan. But when the dust settled, you're still not entirely sure what the fan hit. Confession. Sometimes it's not about having all the answers. It's about recognizing when you need to act first and analyze later. And staying humble when the diagnosis doesn't fit the textbook. If you've ever been in a WTF is going on here moment on the wards, or in life, DM me and tell me about it. I'd love to hear your stories. You can find me over the gram or on Threads or on YouTube on @HafsaSlay.